Thank you, Patrick, for the introduction, and thank you all for joining us today and letting us present. My name is Vaishnavi Jayavalan, and today with Dr. Lizzie Noet, I will be talking to you about my master's thesis project, which was on the context-specific challenges, opportunities, and ethics of drones for healthcare delivery in the eyes of program managers and field staff, a multi-site qualitative study. For today's presentation, we'll be going over the rationale and methods of the study. Then we'll be sharing the findings with you. We will also walk through a case study, and finally, we will end with the conclusion and Q&A. So I'll pass it on to Lizzie to talk about the rationale.
Yeah, and Vaishnavi, thank you very much for inviting us to present because we really do want to hear from everybody in the Fly-In Labs and the broader community on this study. Vi will be doing the bulk of talking today, but I did want to bring people into why we ended up doing this study in the first place. So I'll talk a little bit about the rationale and the methods before handing it back to Vi. So I'm a medical anthropologist, and my interest in drones arose in 2018. I was invited to do a cultural acceptability study in Madagascar for DROT's project there that was introducing TB diagnostics and potentially treatments via drones during the summer. And it was part of a multiple technology project out of the Centre Val Bio. And in coming out of that project, which kind of emerged as an opportunity for me really quickly, I'd been looking at global programs and kind of the politics and ethics of transnational aid. Looking into the literature, it became really apparent that first of all, research on health applications of drones was really very limited. There were many peer-reviewed articles describing technical tests and specifications and challenges related to drones in general. And a few people were talking about, we're starting to critically unpack the logics and social implications of expanded integration of drones in healthcare systems and humanitarian action in global health. But almost no one in 2018 in presentations or publications was speaking with people on the front lines of implementing this technology in specific locales. So there's, as we know, there is, and as Patrick mentioned, there's just this growing enthusiasm and optimism about the potential of drones as a technology for increasing the efficient and equitable distribution of health services. And this has probably gotten even an extra push, we could say, this year yet again, though it's got its own momentum at this point, but with COVID, deliveries of medical supplies, including PPE and the masks and sanitizers, were framed as a means to really mitigate the risks of disease spread through conventional forms of delivery. Disinfectant drones have been proposed, though not recommended necessarily for disinfecting public spaces during this pandemic. And there's also been, of course, the use of drones in many places for public health announcements to remind people about social distancing, sometimes citizen-led and not government integrated, as was the case in New York in April when somebody sent a drone around asking people as part of his self-funded anti-COVID task force to maintain social distance. So what does all of this mean? And what are kind of the complexities of bringing drones into a range of public spaces in the interests of increasing health? So I touched base with Patrick after returning from Madagascar, and he confirmed that there definitely is a need and a gap in terms of looking beyond the technical considerations and imagined landscape of drone applications to learn from people on the front lines about your ethical challenges and your social considerations as you're introducing this new technology into various communities. So next slide, please. Bye. And at the same time, Vi approached me to do a master's and to really work on the question of technologies and health equity remote communities at Western. So we put our heads together with Patrick as well and decided that a kind of low-lying fruit, yet very important study would be to interview field staff and project managers around the world about their lived experiences introducing drones to communities. So here are our key kind of study questions. We wanted to understand ethical and practical concerns or challenges of introducing drones for health to local communities for health, for health related purposes. We wanted to document and understand the types of strategies that are being used to facilitate the introduction of drones for health programs. And in this way, identify some best practices, document and allow them to be shared, best practices for introducing drones to communities who maybe have no prior experience or exposure to drones. So next slide, please. The study was organized around, it's a qualitative study, and we used semi-structured interviews conducted over WhatsApp and Skype in 2019 and early 2020. And we of course wanted to have interviews because our goal was really to gather and listen for detailed accounts of what the realities are of bringing drones for health related purposes. What are some of the values? What are some of the social considerations? What are some of the questions and concerns that might be circulating in the minds of those who are on the front lines? And the project was initially designed to focus on staff only from flying labs around the world. But after a few months of recruitment, it was going quite slowly. As you know very well, sometimes it's hard to contact people who are working with flying labs because you are busy, sometimes in remote areas, always very busy. So after a few months, we extended recruitment through UpDog and ended up by January 2020 with 16 interviews with individuals from 9 countries and 5 WHO regions. The interviews were transcribed, uploaded to a qualitative analysis system in vivo, and then we started the team-based thematic and interpretive analysis, which Vi will tell you what we learned. Back to you, Vi.
So based on the interpretive and directed thematic analysis, there were 3 main themes that were identified. These included benefits of the drones for health project, concerns surrounding the implementation of drones for health projects, and the challenges and complexities of implementing drones for health projects. I'll be going into more details about these themes in the next few slides. Participants perceived that drones for health projects had many benefits, both direct and indirect. Direct benefits included maps, reduced delivery times, reduced healthcare associated cost for patients, and an overall improved outcome.
Sorry, V, we can't quite hear you. I don't know if it's just me. Is it my laptop?
Can you hear me now?
No, I'm having trouble as well.
Maybe try using your theater stage voice and project. Thank you so much. Sorry, Vishnu.
Fine. So directed benefits included maps, reduced delivery times, reduced healthcare associated costs to patients, and an overall improved access to healthcare. Direct benefits were generally explicitly described by participants. For example, drones could reduce delivery time and improve access to healthcare. Indirect benefits fell into the following broader subthemes. So mitigating existing risks associated with traveling on unsafe roads, building local capacity, providing information to improve other non-health related services, motivating individuals to think about how technology might address health related challenges in specific contexts, and creating drone guidelines. So in this quote, a participant said that the drone guideline that they created for their project can now be used for other programs such as vaccinations, blood transportation, family planning, and additional commodity transportation. In addition to benefits, participants' accounts highlighted several concerns related to the use of drones for health. These included both participants' personal concerns as well as the concerns expressed to them and their teams by stakeholders such as elected and traditional leaders, police, army, and community members. These concerns included privacy concerns, safety concerns, and context-specific concerns. One participant said that people were worried that drones would have cameras on them and may take pictures. This concern was raised in various contexts because individuals were worried that these images will be sold, they'll be used for mining, and it might result in surveillance and impact their privacy. Another participant said that they were asked by community members to stay away from the refugee camp because those in the camp are from war-torn areas, so they will panic if they see a drone fly over them. This is an example of how important it is to consider the context of where these Drones for Health projects are happening. Alongside participants' identification of benefits and concerns of projects, various practical and ethical challenges surfaced during the interviews. These challenges made it difficult to implement drones for health projects. Practical challenges included skepticism of the technology, lack of resources, technical challenges, lack of guidelines and regulations, and an inability to access stakeholders. Ethical challenges included aligning with community priorities, perceived limited understanding of project. These are community members' perceived understanding, and the need for transparency and honesty in project management. And the final one is the complexities of informed consent. In relation to obtaining consent, one participant said that one thing is that maybe they couldn't say no to the ward heads, so because of that, also community members agreed. This quote describes the ethical challenges of obtaining consent as community members may be agreeing to projects because they do not want to disagree with the ward heads of the community. Even though I present the practical and ethical challenges and complexities as separate, they are interconnected. It is important to understand that this is interconnected so that these challenges and complexities could be addressed and appropriately mitigated. Now, I would like to share a scenario that a participant described during their interview. We are currently writing a paper based on the scenario and thought we could get your perspective. Some of you are those working on front lines of these Drones for Health projects and have lived experiences of going into communities and introducing Drones for Health projects. I'm hoping to incorporate your perspectives in the paper as your insight will be tremendously valuable. We will acknowledge the script's input during the session in the paper. So for the scenario, a team working on Drones for Health project went into a remote community to do a mapping project in order to understand the hazards, health risks, and safety concerns caused by the flooding of a nearby body of water. To do this kind of project, the team usually gets permission from the elder of the village or the landowner by participating in a traditional ceremony. Then the team engages the community by hosting a gathering or having a drone demonstration to describe the project to the local community members. Unfortunately, there was a death in the village, so the village was empty the day the team went into the community to execute the drone project. So the team participated in a little ceremony with the village head present. They got the approval from that village head to fly the drone and take pictures of the village for the mapping project. Since no one was in the village, the team did not hold a gathering nor conduct a drone demonstration. They completed their job and left. I would like you to take the next minute to write your thoughts about the scenario in the chat box. What would you have done in this scenario?
Yeah, so I mean, the issue here that is there being norms for a community engagement practice and consultation with the entire community versus the pressure of getting the project done on a timeline, and with the funeral and many people being away, that consultation not being. We have Yusuf. Why are you gonna ask people to elaborate on what they're proposing maybe?
So, Yusuf, would you like to elaborate on why you would not fly on that day or what else you would have done?
Great. Thank you for the opportunity. From what I have understood, can you hear me?
Yes. Yeah.
Okay, perfect. From what I have understood, everybody was ready to welcome us. And for them, just to make it more clearer, they wanted us to do a demonstration before we execute the actual mission. But what's happened, it was like a test that we said to the team to say, what do they value the most? Do they value their work, that they just want to fly on that area and get the information done? Or they also value the community from what has happened to one of the villages? That's why I said, even if I was prepared to fly on that day, I will not do so, rather than take some time, and if I can actually be with them to show them what I had to do, the data I had to collect, it's not like high valuable than what has happened to a village, because no one has planned for that. So that's why I say I will not fly on that day.
For your answer. That's very interesting. So understanding what your values are and what's important to you. I think Dania said she had, or they had a similar experience.
Yes, hi, good morning. Last year, talking about 1 year and 1 month ago, we visit an island. And when we visit the island, Gardi Sugdu, Patrick, that day, the person was not, he didn't live at the island, but his family live at the island. So they bring the body to the island. In our case, having the body in the island represent that night we will have more light in terms of, because normally they cut the light, but that day they will do their ceremony in the night, so we will have more light. We flew the day after, because the island has 1,000 members. The community is about 1,000. It's a lot of people, so it's not as a small village. But even though I think we spoke, we didn't know at the very beginning. We were at the other side of the port, and we tried to fly, but we have rain, so we stopped everything. And then we flew the day after. We made our project. But that night we just rest, and we were at the island. But it was big enough. And I think that at that moment, it depends, and you need to evaluate the considerations of the inhabitants of the place or the village, because it depends of the relevance for them in terms of what represent for them, if they are going to have a ceremony, if they are going to have a funeral, or is just like in other countries that someone is already dead and everyone continues. I think that at that moment, you need to talk with your contact from the community and make the best evaluation to take decision. And in case, in what happened in your scenario, I think that the great decision was to wait, because what seems is that the funeral has a lot of relevance.
Thank you. Did you plan for your, any issues happening, like in terms of days? I know you waited a day. Did it affect your project?
Well, we always, when we plan to visit a faraway area, we try to have at least like a buffer of 1 day, because in Panama we have a lot of rain and we can have a lot of situations. Even you make your checklist and you try to have everything by the book or in order. And what we did is the day after, we fly like 7 polygons, more or less, 7 different locations, but we start like as soon as we have the sun, we start, and we just keep flying and moving from one area to the other, because we were planning to fly Saturday, but due to rain, due to the body, due to a lot of things, we just say, okay, we will go ahead the next day, early in the morning, and continue with everything.
Thank you. And I think
Sorry, can I just ask as well, Dania, was it a situation where it was the first time that you were flying the drones?
The place, you say?
Community?
It was our,
yeah, was it the first?
It was our first visit. It was our first visit. In the evening of that day, we have a lot of kids. So what we did in the afternoon, because we saw a lot of kids, what we did was like a small demo, but with the kids that day, because they were like running everywhere, etc., etc. And it's interesting because I think that for them, funerals, they respect the funerals, but it's not like all the community will have like all the day off. They have a special ceremonies in the night. So we were not in interference. And also, if you are not part of that community, there are some ceremonies you are not allowed to be also. We, to give you an example, we tried to visit that island since the 2018, and we found the opportunity 1 year later, and we make efforts. So they are very close, but at the moment you are part of the community, you are part of the community. Right now we are part of the community, and they consider us in their programs. We are invited to make live in Facebook, everything with them. So now we are part of the community.
Oh, thank you for sharing, Danya. That's great.
And then I think Tawanda said to also come back another day or inform the village once they returned from their funeral. So Tawanda, would you still conduct the project and then tell them, or would you wait till they come back?
Can everyone hear me?
Yes, yes.
All right, perfect. So I think for me, I then wrote here just when I was listening to Danya, is really it has to be a decision made in context to what's happening on the ground. And I like what Danya was talking about is that in some cases, if the funeral, depending on the village and how they, perceive funerals and how the community comes together, it may be a situation where it's not wise to continue with it because it could be seen as disrespectful to the local culture. It could be seen as, just going against local practice if everyone is involved in the funeral kind of space. Also, the context is whose funeral is it? It could be someone really important, the person who's passed away. And then in other contexts, in other cultures, it may not be necessary to stop everything. Some people may have gone, but it may still be okay to continue with it. So I'm not sure if there's a blanket kind of say this is the right way or wrong way. I don't think there is a formula to say there's just one way to do it. I think context is very important. Also, the chief or the ward, whoever you're dealing with, also their rank, their understanding of the technology, their understanding what we're trying to do, whether they've informed the village people ahead or in advance that this is what we're going to be doing is also a big factor to consider in all of this. So I think it's a situational context that we need when making a decision on some of these things.
Thank you. Thank you all for sharing your thoughts. And like Tawanda said, context is everything. And when we even had some questions that we were left with after listening to this scenario. And like many of you, the participant themselves shared that they were also not comfortable in the scenario. So based on this scenario, I will be presenting some of the questions that was left in our minds. And hopefully you can also think about. So an ethical challenge that I noticed was that the Drones for Health team could not obtain consent from individuals in the community as they usually do this community engagement initiative. So this probes questions such as whether the Drones for Health projects require consent, informed consent, and are these Drones for Health projects categorized as public health initiatives or research projects? As when you categorize it as one or the other, there's different kinds of questions you have to ask. And I know with research projects, you need to have that individual informed consent, and public health initiatives, we're not sure about that. Another thing is that the Drone for Health team got approval from the elder of the village, which may be culturally acceptable. However, is it sufficient to obtain approval from the elder of the village? And how would Drones for Health team be able to determine who the appropriate representatives are of the village? Based on some of these questions we had, and similar to what you've told us, we think that given that people are leading really similar drones for health projects, and they're categorizing it differently, research project versus public health initiatives, there appears a need for more discussion as to how these drone projects should be categorized in order to better determine the team's responsibilities to engage in individual informed consent processes. A document could be produced that explicitly outlines the activities regarding individual consent, and this could help teams determine what their responsibilities are. Another one is, like most of you mentioned, if the Drones for Health project does not address urgent needs such as a flood, a drone team could visit the community more than once to do the actual community engagement initiatives, and the next time to do the drone flights. Separating the task will give drone teams more time to focus on ensuring that the community understands what is going on and are not rushed to do the drone flights. What are your thoughts about these recommendations, and do you have any other feedback or recommendations for future drone teams? And again, feel free to put in the chat box or unmute yourself and tell us what you think.
And I've just put in into the chat like a reframing of the questions as well, in terms of, is it helpful in terms of, as people who are on doing this work, do you think that there's a need to have more discussion about, how to get permission when you're starting to introduce drones, or is it pretty, has it been easy to handle? Are there sometimes tensions in terms of, wanting to consult more than a leader or a group of leaders? We're curious about your needs and interests in this. And I'll let you, Vi, read as well. I see Patrick put in a comment.
Yeah, so Patrick said, in the humanitarian context or disaster response context, there may be little time to get individual household context, especially if we're talking about hundreds or thousands of households.
Yeah, for sure. And I think that the tension that Vi surfaced as she was going through the literature, based on some of the people interviewed felt, a bit uncomfortable about only getting, sometimes about, or not sure about who you're consulting in the community. Do they really represent the interests, especially if afterwards somebody says vocally to the team of people bringing in the drones that they're not completely comfortable with one of the activities. It makes you question, what are your responsibilities as the person leading these projects? How does one go about a consultation process to kind of mitigate risks of tensions and maintain good relationships? These are some of the questions raised. Thank you for that link, Patrick.
Guys, can I chime in here?
Yeah.
Okay, so from my context, just I think on one of the projects that we tried to work on some time back, was really a question about scale. Is that there was a cyclone that hit our country, and that was at a national kind of level, and it really hit part of it was really more in a rural kind of space and context, but a large area was devastated. And in that context, there was no, even when we were seeking permissions, there was no, there wasn't really consultation at that local level, because then it was government getting in there, it was civil protection, it was the army. And it was really at that level that the approvals came through. And no one really looked at ethics as being a consideration, because it's a national disaster type of thing. And you are having to go out there and respond or help or gather data information. Now, when it's a thing where it's a planned project, where you have the time to do it, where you're not trying to go there out quickly and that kind of thing, then I think the situation is different in terms of who you get the approvals from and to what extent you go to find whether it's the chief or the district officer and that kind of thing. So I think also the scale and magnitude of what you're trying to do is also, I think, a big consideration around who has the final say about whether you go out and whether you need to go individually to get the community consent to carry out a project.
Well, thank you very much. And certainly, I mean, I think that, you know, Patrick raised the point as well about emergency contexts, right? And at the same time, as somebody who does a lot of work in humanitarian healthcare, there are contestations of, you know, like, is there a responsibility, and not specifically for a particular group or flying lab, but in general, there's often this excuse in humanitarian healthcare that because it's an exceptional situation of a disaster, it's impossible to actually go through routine ethics processes. But we all know that there is some experimentation or testing of drone uses during humanitarian response, because, you know, there are particular uses of drones that are uniquely suited to humanitarian responses. And so there is that first time. And I guess there is a question raised there, like if it is a research if it is research in a way, then do you have that responsibility to consult at least with the leaders in that situation, even though it's a disaster? Do we, yeah. But I do appreciate also the comment about context again there, Tawanda, in terms of timeframes, and Patrick, feasibility. I guess I worry about the, I worry about having, I worry about not having the conversation, but I'm a social scientist. So I guess that's what I wonder, like, is it okay even in humanitarian crises to kind of roll out new uses for drones? And I do wonder, what are the responsibilities, and should there, you know, what guidelines are there for consultation in that really difficult for consultation context? Does anyone want to respond? Even Patrick?
I could talk about this for hours, rather not. If other flying labs have other comments, observations, or questions as well, please feel free to unmute and share, or also use a chat.
Maybe I can just continue on, and then if anyone has anything they want to add on later, I might give them some time to think.
Thanks.
Yes, good morning, guys. I'm sorry, are we done?
Yeah, go ahead, Orlando.
Oh, hi, good morning. This is Orlando Perez from Dominican Republic. I was just remembering some of the final conversations and with the team in terms of the conclusion of our flights within the San Juan province, where we were transporting medical samples and goods for close to 2 years. And one of the conversations that we had in terms of context was how amazing it was that, for whatever reason, this community in this particular rural area was very much engaged and, I would say, sort of happy what was going on. And the conversation was basically turned on that, since we were thinking about going to other locations, and we had these initial conversations with the same level of the community and with the health ministry also being involved, the feedback and the response was not similar. I mean, we were having some pushback from certain locations, and we were thinking like, well, is this a regional context? Is this something that just because it's because in another province and so forth? So we were trying to understand why we were getting a green light on one specific community and why we were getting a bit of a pushback on the other. And I think the conclusion was that, at least with this experience that we had in this particular region, a lot of the health workers within the system that usually tend to rotate from one province to another, either because they're interns or students or whatever, most of these rural hospitals, the individuals in the health community were locals. I mean, they have been there for quite a long time. So our impression was that the community was very much engaged and happy because it's basically having their own people running the show. And that, what was a good feedback. I mean, it was like, no, we're not going to put any opposition because it's one of our own that's within the project. And another comment that also emerged every once in a while, and we didn't quite notice until it happened a couple of times, was that most of the parents of the very young kids from the community that were always, hanging around the hospital, trying to get access to the rooftops to see the technology and see the drones and ask questions. And we would just spend hours and hours just talking with them, and taking pictures and so forth. They would come back to us and say, you know what, this is so great because one of the biggest hurdles that these parents have is how can they assure that these young kids just don't go wandering back to the bigger cities and just not have a clear path of what's going on and get distracted in so many bad situations in terms of whatever they're going to be doing when they're adults. So the basic response was, thank you for having our kids at least have some interest in technology and things that are not within their normal scope in the rural communities. And to be honest, I have a couple of kids and I have a 10-year-old now that he's very much engaged in technology, and we're in these meetings in which we know that if we have the proper access to these young kids in these ages, it most likely would have a robust effect on what they're going to be doing in the next coming years. So I think that was part of the green light that we have from the community was thank you for having our kids be able to play around with your stuff.
Thank you, Orlando, for sharing that because that is something we also noticed in one of the findings was people were motivated because of the drones. So it aligns with our findings, and it's nice to hear that, and especially the fact that you use community engagement and how that makes an impact of one community accepting the project, whereas another did not give you that green light. Um, so, in summary, this project highlights for the first time the ethical and practical challenges and complexities of drones for health project. It provided an initial series of considerations that could support the creation of global guidance for the introduction and implementation for future projects. And it emphasizes the need for community engagement, like Orlando said, when implementing such drones for health projects. So there's no doubt that further research is needed. More research should be done to include community members' perspective of these drones for health projects, and this research should be done at different stages of the drones for health projects. This study is a first step in advancing evidence-based understanding, the impact and complexities of using drones for health, with a focus on this use in remote settings. Next steps include creating, in collaboration with stakeholders, a global guidance that Drones for Health teams could use and tailor when implementing Drones for Health projects. So I just want to share this final quote with you as it really struck me when I heard it. So a participant shared to me that they feel that the people who they are talking to are so innocent and they are usually illiterate. So these people, they're innocent that they don't understand the technology, so they cannot think about anything negative or cannot foresee privacy issues. So if you explain them something in a good way, then they easily trust you. This quote captures several factors that can make the introduction of drones for health ethically challenging. This quote refers to target populations' perceived limited understanding of the technology, potential limited experience critically engaging with new projects or technology, and the question of the responsibilities of drones for health teams. We know from our interviews that those on the front lines of Drones for Health projects are overall very committed to communicating with the population in which they're introducing their project. They're committed to transparency and honesty and respecting the populations with whom they are working with. But how and to what extent is the responsibility of field staff to ensure the understanding of the project, this remains unclear. This quote highlights the importance and the need for further push to discuss and create a document and share any best practices that drone teams are using to be transparent with community members and support populations with limited prior exposure to drones, but also engage community members in these Drones for Health programs to critically think and evaluate Drones for Health projects. Community engagement is both an ethical and practical imperative of doing global health work. Participants reported that it helped overcome some of the ethical and practical challenges they faced when implementing these Drones for Health projects. Community engagement can inform drone teams on how to ethically implement these projects, improve communities' acceptance of the project, and make it easier in the future to transfer the ownership of the projects to the local communities. So with that, if you'd like to learn more about the study, it has been published in the Drones Journal, and I know Patrick said he shared it with everyone. And then I would like to thank the following individuals for helping and guiding me throughout this project. Thank you. If you have any questions, answers, comments, let me know.
Thanks very much, Vaishnavi. Thanks a lot, and Isa as well. I think for me, what this underscores is how vital the need is for independent, rigorous, applied social science research. Obviously, with domain expertise in public health and so on, that is not something that we can do or should do on the WeRobotics or Flying Labs side. That is not our comparative advantage. And so I think for me, this just drove home the point of really engaging more with researchers like yourselves and across different domains and different countries to provide these kinds of independent findings and insights that have direct, implications in terms of future delivery drone projects that Flying Labs are going to carry out. So you've really filled a really important gap, as Elise mentioned. There's not that many studies out there that go beyond just the almost obsessive focus on technical performance and specifications of drones to actually the human side of all of that, and that is just it's hugely important. So thanks for leading that. Let's see, do we have any questions? Luciana from Village Reach also shared a study that they did I think this was connected to the DR as well as, I didn't know that, to stakeholders of theirs in Africa. And also put your study there as well. So we have about 10 minutes left. Do any Flying Labs have any questions, comments, observations, including on topics that have not necessarily been addressed directly? If you have something else on your mind in terms of ethics, consent, questions, now's a great time to ask. You have the attention of Vaishnavi and Elise. So I'm opening it up. Feel free to unmute or use the chat.
No question per se. I just want to congratulate. Thank you so much for sharing your study. It's really important. I remember we had another study, Patrick, which we wanted to understand the perception of drone particularly. And then that study was really about Tanzania and Malawi. And you can imagine some of the people perceive drone as a witchcraft. And so you need to understand when you are going to work on such community, how important it is to get their consent before you even start flying, even for demonstration, actually. So thank you so much. And just a rule comment when it's come to getting the consent from the people. We all know like there's a level of getting permissions, and it started from like the legislation framework, like the laws, but after that it's really about the ethics behind it. And we in the network, we really value both of these. It's like we're trying to look whether it is ethical, we can do the project, or it's legal, we can do the project, and safety aspect as well. But when it's come to the ethic, I think this is something which is really people have to keep in mind. Our projects are not so important as the community itself. So we always have to think twice before saying we will specify a small amount of time to let the community understand on what we are doing, and then spend a lot of time executing what we want. And this is actually why we want all the flying labs to take opportunity to provide the awareness on the technology, not just because there's a project, but also to make sure the community within their local extent understand the technology, so that whenever we want to do a health project, whether it's an emergency, whether it's a research perspective, then people doesn't have to use too much effort to tell the peoples what need to be done. And I love the comment when on one of your participants who said, for sure, people are innocent. They are innocent because they don't understand this technology. So if you can use a better words, then probably you build a trust on them, and then you can do what you want. But sometimes people use that as a weakness. On the other hand, they're trying to tell people a beautiful words when it's come to the technology, and they are not so open on what they want to do, but they're telling something different on what they are going to do at the end. So this innocence of the people should not be taken as a weakness, rather than people should take it as an opportunity to tell them exactly what's going on when it's come to their privacy and how privacy are handled at the end. So that should not be taken as another weapon, unless when those kind of community become to realize, then it will become very difficult for others to have an opportunity to do the same, or to do a similar kind of project on that specific area. So we always have to think twice before we are trying to say we have a really limited time, so we have to execute our project rather than making sure. I love the example of Daniel, and that's really a better example. It took them a year, and now what they got in return, they got a family. So that's the results. If you're investing time to make sure people, they really understand what are the pros and cons of what you're doing.
Thank you, Yusuf. And yeah, again, a lot of the interviewers we did, participants we did talk to, did mention the importance of being transparent and honest, and not over promising with the drone project. So thank you for pointing that out again.
Very good. Thank you as well, Yusuf. I really appreciate your insights. I think with that, we're getting at the top of the hour. So I want to thank you all for engaging, for joining, for listening in. We will be putting this webinar on YouTube and on the WeRobotics blog, and sharing it widely as well. So that will be coming up in the next few days or so. Thank you again, Vaishnavi and Rize. Really value this collaboration, and what you've published is obviously extremely relevant to all of us, and in particular Flying Labs, who are the ones who are at the forefront and having to make these decisions, which don't always have a obvious answer, and that they're tricky. There are different factors at play, and being able to have these kinds of discussions on webinars and so on, and also having the kinds of studies that you have published, that really helps move the conversations in the right direction, so that all of us can be more informed and leading drone projects in a way that are appropriate and ethical and accountable. So a big thanks. It really does it takes a village. So I really appreciate the opportunity to collaborate with all of you. Thank you again for your time, and looking forward to further collaborations.
Thank you for inviting us, and thank you all for providing your insight, especially on the case scenario.
Yeah, thank you very much.
All right, everyone, be well, stay healthy, take good care.
Bye,
Thank you. Bye.
Bye now.
Yeah. Bye.